Hi, everybody. Brianna with Nurse Deck here, on with another installment of our Insider Perspective series. Here at Nurse Deck, we are built by nurses for nurses. We aim to provide a collaborative social space for nurses across all levels in order to share resources and guides, camaraderie, humor, work life, sanity savers, anything to get us through our shifts and when we're off the clock. Today, we are joined by Meedie Bardonille. Meedie is the Surgical Oncology Nursing Director for a large acute care facility. She is also currently she serves as the chair for the DC Board of Nursing, which we will definitely discuss. She is a passionate clinical advocate and is someone who strong servant leadership shines through across her many roles in the nursing community. So welcome, Meedie. We're so glad you could join us today.
Hi, Brianna. Thank you so much for having me. I'm excited. Thank you so very much for this opportunity to share on your platform.
Absolutely. So we always like to start at the beginning. Where did you get your start in nursing? How did you get into it?
So excellent question, Brianna. And what I will share is very early, I lost my mother, unfortunately, at the tender age of 4. And when my mother was in the hospital from cancer, I remember wanting to be like those folks that were helping her, taking care of my father. Was a young father of 2 young children. I was 4. My brother was 8 at the time, and just kind of navigating those waters. And I just literally remember always wanting to be, her name was actually Nancy. I will never forget her. Forgot her last name, but I always remembered I wanted to be like Nancy, who just went above and beyond the call of duty, making sure my dad understood what was going on, how my mother was feeling that day. And I literally wanted to emulate that and really make a positive impact. So when I was early in high school, I was a candy striper. And so I truly knew something and had the passion for wanting to be the nurse that I wanted to be literally since the time I was 4 years old. So I'm grateful that 44 plus 40 years, I have been able to see it come to fruition. So that is where my passion literally stemmed from, seeing people make a true impact in the lives of others.
Yeah, that's incredible that you remember her name too, for being a 4-year-old with so much else going on. I mean, that just really speaks
my mother passed away. I remember, and as nurses, and particularly now as an adult, you always should make sure you kind of have that barrier, if you will. But I remember Nancy and her family, for whatever reason, she really connected with my father as he was going through this process. And so her and her husband befriended my father. And I remember being invited to a few of her kids' birthday parties, and even to our birthday parties as we got older. So I lost contact, but I will just never forget how important that was.
Yeah, absolutely. Wow. What an incredible story. You mentioned you're very passionate about your role. What keeps you motivated in nursing right now? I mean, we're going through such a stressful time as a community at large. What do you find motivates you?
I know this is very cliche-ish, but really it's just the opportunity to serve. I've oftentimes reflected on why I do what I do, why I love the profession that I love so much. And I really believe, the adage of service is the rent that we pay while we're here on earth. And so even in the middle of a crazy pandemic, I was late to meeting with you this morning, just ensuring that staffing was right, that my team had what they needed this morning. And that was what's most important for me, is really making sure that people have what they need, even at their most vulnerable time. So honestly, even when I'm tired and stressed and burnt out, all of those things that all nurses and quite frankly, anyone in healthcare is feeling, for me, it's knowing that I'm making a difference. And so that's what keeps me going.
Yeah, absolutely. We need each other right now more than ever. So I'm sure your team is lucky to have you if you feel that strongly connected with them.
Yes.
Tell us about being one of the 3 chosen for the 15th Electoral College for DC back in the 2020 presidential election, which, as we remember, was a huge election.
Absolutely.
Yeah.
It was very monumental for me in a couple of reasons. One, I'm grateful for our Mayor Muriel Bowser for acknowledging, the power of women, right during the women's suffrage movement, which actually celebrated its anniversary in 2020 as well,
Right.
for 200, for that time in 2020 rather. And additionally, to be a part and to be selected as a person to really represent our nursing profession, she was very intentional as we actually ended up talking, like, how did you come to this decision? There was another frontline worker. There was another person my other colleague who actually also joined, was an LGBTQ advocate as well. And so I'm really grateful to be acknowledged as a frontline. And I hate the word hero, to be very honest, because I think nurses don't really, we don't wear capes. And I appreciate the accolades that our profession has received, particularly the last 2 years. But it is very hard. And so sometimes we take that cape off. I digress. But the point is that to be acknowledged to represent the District of Columbia and the over 700,000+ residents was very, for me, just so significant, regardless of your party lines, right? Regardless of your Republican, Democrat, Independent, whatever, to be able to be chosen as a nurse and as a African-American woman. It was also very interesting as well, Brianna, because I had the opportunity to vote the first casting vote for the first African-American woman vice president. And obviously that was very significant for me. In addition to Kamala Harris also is a fellow alumni of our illustrious alma mater, Howard University. So it had really interesting ties that were intertwined that I do know that Mayor Muriel Bowser did not necessarily think of. But for me to be a Howard grad, to vote for another Howard grad, in addition to be another Black woman, being able to cast a vote for another Black woman was absolutely tremendous. It was definitely an honor.
I can imagine so. Yeah. Well, let's talk about, and speaking of honors, you have received a number of awards. I just wanted to highlight a couple of them. You're a member of the Washington, D.C. alumni chapter of Delta Sigma Theta sorority. You were recognized as Mother of the Year in 2019 and 2020 for exemplary service to the chapter and the community. You've also been honored with the President's, I love this, Shiro Award from Prince George's County chapter as a 2021 Catalyst awardee. I mean, that's amazing. Amazing. Tell us more about this organization and its mission, its vision, and what it's meant to you to win those awards.
Awesome. Great question. And I just want to add a little bit of understanding that I am humbled and grateful for the opportunity to serve. And I think there's been a lot of negative energy around this pandemic, particularly with the nurses and healthcare and what we've been doing. And I really just want to say, I believe these acknowledgements have really just come because such a time as this. If not you, who? If not now, when? And so for me, I've been doing the work. It wasn't that something just started differently. And I'm humbled and honored to be acknowledged for the work that we've been doing for, quite frankly, all of my professional career. Delta Sigma Theta, which also was another, to tie it back to actually the Electoral College, my sorority was one of the only Black organizations that actually marched during the women's suffrage movement. So to be able to be a presidential elector when women were fighting for the rights to vote. And my sorority was founded based off of service and social action was also another very interesting thing. So Delta Sigma Theta is one of the largest African-American sororities based on sisterhood, scholarship, and service. Big word for me, again, is service. And so that's what I've been honored to participate in. The other two awards, a Mother of the Year, is from my organization that I'm a member of. I'm a chartering member of the nation's capital chapter of Jack and Jill of America. And Jack and Jill was formed back in 1938 by some amazing women in Philadelphia during the Great Depression, quite frankly, wanting to find ways, how do we still keep these Black and brown children engaged, keep them safe, have activities for them, and making sure that they still see some positive light in the world. And so we basically are a group of mothers that seek to have what I call, we do motherhood together. So I something that I've loved being a part of this journey. And so we are a group of mothers that tried our best to create programming around service, around educational opportunities, around community service, and leadership for our children. And so I've had the opportunity during this last year or so, because of the pandemic, quite frankly, of really making sure that we understand how important community is, how important service is. And so some of those awards were given because I've used my own personal platform, social media and otherwise, to really talk about the importance of maintaining your health, Brianna. And as you could acknowledge and appreciate as nurses, for nurses, is that I really hope that people continue to keep their health at the forefront, not just because of COVID-19, to really understand the impact of having all these comorbidities, the morbidity and mortality, specifically that underserved communities experience. And so because of that, I was acknowledged for my service. In addition, I was able to partner, and I have to say this, I'm so grateful for Dr. Gigi Albayumi, who is one of the leaders and the founding director of the Rodham Institute at the George Washington University Hospital Center. And we were able to, and we were, because of Dr. Albayumi and the Rodham Institute, we were able to secure over 100,000 masks that I helped to disperse throughout some of the community organizations here in the District of Columbia, and over 6,000 things of hand sanitizer to the community. So because of that, we were really also help do our role to help eradicate this the pandemic that we've been still living with.
Yeah, amazing. I mean, I think we forget that about the beginning of the pandemic, as scary as it was for all the uncertainty that it brought in. There was also so many aspects and examples of people rising up to meet the challenge in whatever way they could make it work, which to me is such a nursing quality. You know, we figure it out and we make it work no matter what circumstances we're thrown into.
Absolutely.
And it was nice to see our communities doing that for us, you know, like sewing masks and dropping them off, and how cool to be part of that. And I don't want to say I miss being in that part of, but that energy at the beginning of the pandemic where people kind of rose to the challenge. It's great to hear about that. And that
was a little silver lining, quite frankly, if you thought about it, Brianna. Even though obviously, you know, over nearly 50 million lives impacted in the U.S. from contracting COVID, we're nearing, you know, I think we're already over 500,000 people who've lost their lives to COVID. I'm always just an optimist. So what can we learn, or what did we learn? And then it's really community, and it's really service. And so to your point, nurses who have, even this year for 20 some years in a row now, have been noted as the most trusted profession, but we've never always received the accolades and the recognition, as well as our teacher counterparts, right? So now we have more appreciation for these people that are really doing the work that help our community thrive and survive, quite frankly. So absolutely.
Yeah, absolutely. I couldn't agree more. Tell us about, we're going to switch gears a little bit. I know you've done a lot of work for patient care and patient-centered outcomes and improving nurses' quality of their experiences on the job. What do you think are the biggest drivers for quality patient care?
To understand why you do what you do, and then to also understand the impact of what you do on that person's life. I know it's not some huge scientific algorithm, but I live it. I see it. You know, washing your hands, a simple thing, Brianna, as washing your hands. You know, the world was into this huge thing, wash your hands, the pandemic, and people like you and I, well, you should have been washing your hands, right?
Why are we having to teach you how long you do that?
Hand sanitizers and the importance of hand hygiene. But what we understand is what I seek my best to instill in my newer nurses and the team that I lead is that what you do makes a difference. Literally, from ensuring from quality outcomes, from making sure that you're doing your hourly rounding, to making sure that you do the 4 Ps, you know, pain, position, potty, possessions that we've learned, you know, back in nursing school, so that elderly patient doesn't have to reach to grab something and they fall, to make sure that you are indicating about this is your last pain score and this is how we're going to help to manage your pain, and no, you won't be at zero, so we can also counteract this opioid crisis that we're dealing with, and letting people understand, no, you won't be at zero. It is our goal is to make sure that your pain is manageable. And so and then as it relates to just other quality measures, at my organization, I lead our committee for CLABSIs, central line infections. So nurses understanding the importance of hand hygiene, using the alcohol and breaded caps to make sure that the ports of entry are clean, to not access it as much as possible, to make sure that you're reducing any entry level of bacteria into that central line. So again, it really all comes down to understanding why. Why are you doing what you're doing? And then for me, it's putting a face. I've just met you today for the first time in person, but what if you were my sister? What if you were my best friend? What if you were my neighbor, my mother, somebody that I know and love and care for? I'm going to want to do the best to make sure you have the best outcome. And so we can come up with all the algorithms, we can come up with all the technology, but there's still a human at the end of that who has to that knowledge to that patient. And so of all the professions that we have, of all the technology that we have in healthcare, there is nothing, even with robotic surgeries, there's still a human who has to manipulate and manage the robot. And so we unique that regardless of the technology, you are still dependent upon the person that is utilizing it to make sure he or she is doing the best to have the positive outcomes. So that's my viewpoint, is understanding the why, and making sure that you see that person as not a disease process, not as a diagnosis, but as the mother, the sister, the brother, the father wants to get home and be healthy and well.
Right, exactly. This may be the 10th person going in that you've cared for going in for surgery, but you know what? This is the only time they're ever going to have their gallbladder out. So for them, it's a big deal. And I love how you mentioned, really driving home the point to new nurses, especially that, there might be a big problem that comes up down the line for a patient, like, going into septic shock because of massive infection. But it starts with that point of entry to a central line where you didn't scrub it for a long enough amount of seconds, and little tiny things can snowball into much, much bigger things. And nurses have the power to control that.
And Brianna, I would even gesture to say it's important for everyone in particularly any healthcare realm or medical field, that every person has an important role. And I always, I also always engage our EVS workers, who sometimes in hospitals are the least valued and underrepresented as the important part of the team that they are. So I always say to them, I'm a CV ICU nurse, cardiac ICU nurse by trade. And so even though the physician might have saved you from your heart attack and did that, triple bypass and replaced your mitral valve or your aortic valve, but if the table in the OR was not cleaned appropriately, if the instruments were not cleaned and you had that septic shock, well, you're going to die because something wasn't cleaned, not because of the actual heart attack. And in my current role, the cancer is not what killed you. What's killed you is the fact that you had a bad MRSA infection, a C. diff infection. That is real. That's what took you out, not the cancer. So understanding that the person who is cleaning the room, the person who are cleaning those instruments, are just as valuable as the skilled hands of the surgeon, as a knowledge of that nurse that is administering the medications at the bedside. So it's important for us to really drive that home, that the totality of the healthcare team is not just the nurse, the doctor, the physical therapist, it's everyone that is in that building.
Yeah, exactly. So that's so true. Talking about the COVID-19 pandemic that is still going on, what are the major changes or challenges that you've faced in your leadership with regards to that?
I hate to say this, but really it's just staffing, and it's staff morale and wellness. I say staffing because nursing has had a nursing shortage since Florence Nightingale. Let's just be honest, right? And so we've had this nursing shortage prior to the pandemic, and the pandemic has really just pushed us over the edge. Like we're at the abyss. And so for me, my priority is really making sure, as I shared with you earlier, being late even for our interview, is making sure that our team knows that we're there, that we care for them. We're truly in this together, not just by lip service, but by word and deed and presence. And to let them know that we will do all that we can to ensure that you are safe, to also ensure that our patients are safe. And I view my team members as my customers just as much as my patient. I have to make sure that my team has what they need to do their job, so I then can expect them to perform and excel and do what they need to do to make sure that patient has what he or she needs. And so for me is really making sure team members are okay. There's what I call nurse burnout, and then there's compassion fatigue. Burnout, Brianna, can easily be fixed. I know people were like, what do you mean? Take time off, go on a vacation, have some time with your family and friends. Burnout is no different than when you do a really, really hard workout and your muscles are sore. It requires rest, it requires relaxation, and it requires rejuvenation. You have compassion fatigue. That is when you mentally are absorbing the day-to-day traumas and you no longer care. You are no longer able to absorb emotionally what is happening. So when, as I shared with you at the onset of our interview, that nurse did not have compassion fatigue. She went above and beyond. She made sure that she truly cared, not just for my mother, but she cared and saw her as a mother and as a wife and as a young wife. And to make sure that she's literally on her deathbed, she cared about my father as well. And so when, as nurses, if we don't have that compassion fatigue, it's going to be a really big problem. And you start to see that now. There's many things, YouTube videos, nurses going live crying and, being frustrated and not wanting to come to work because it's hard and it's challenging. Even nursing leaders, I know of nursing leaders who literally quit during this pandemic because they literally just cannot continue to bear the stress. So mental health, mental wellness of the team, and doing our best to get as many talented nurses as we can is very important.
Yeah, absolutely. I mean, I love how you delineate between the two, the burnout and what you're describing really is the moral injury of continuing to do a job that you feel like the system that we're working in is so overloaded. It has nothing to do with your capability alone as a nurse and your skill set, but you're working against this mountain of obstacles ahead of you. And it's perfectly understandable that, you feel like you're just not being able to do your job every day. And that over time, eats away at you, not just your, fixed by a good night's sleep. But I like how you delineate between the two of those. That's such an important distinction between the two.
Yeah,
and I know
like
a lot of nurses.
It is definitely a moral injury, and I'm going to borrow that. It definitely is a moral injury because you're like, I keep coming here every day. You have the moral issue, particularly with COVID. You have patients who are vaccinated, then you have those that aren't vaccinated, and those that aren't vaccinated tend to be the sicker ones, and you put yourself at risk because however you feel about the vaccination process, you emotionally are kind of like, okay, but I'm taking care of you, but you didn't do what you should have done, but now I have to put my life, my personal health and well-being at risk to care for you. And then there's short staffing and people are leaving and they're frustrated. So it's hard. It's really hard to come every day and fight that uphill battle.
Yeah, for years now, and it's just really not just getting through this one crisis period. It's existing in a crisis, that's
exactly.
It's unbelievable in some sense, but it's also just, my heart goes out to all the bedside nurses that are out there right now because it's incredible what they're able to pull off.
Absolutely.
Let's talk about your role as the chair for the DC Board of Nursing. I think a lot of people hear Board of Nursing and they immediately are like, what did I do?
None.
But really, the regulatory oversight needed for over 25,000 nursing professionals, I think, are in your area. I'd love to talk about what you see as the impact of COVID-19, that the Board of Nursing has had to deal, different issues they've had to deal with, and just a little bit about your experience serving in that role. I'd love to hear more about that.
Thank you. A lot of nurses don't really, and that's something I think we should kind of fix in academia as well, going through different curriculums, is understanding, we all know about the Nurse Practice Act and all those different things, but we didn't really understand how to protect our license. How do you go about getting your license? What does that really truly mean? So I'm humbled, as you said, to serve as the chair of the DC Board of Nursing, which, yes, regulates over 25,000+ individuals licensed to practice in DC. Fun fact, there are only about 3,000 nurses that are actual district residents. The 20 other plus thousand are those that are in our sister jurisdictions, i.e. Maryland, Virginia, licensed to practice, but that are not actually district residents. And so a lot of times, wow, there's 25,000 nurses in DC. No, it's actually much smaller because DC is still not a state.
Sure.
But the opportunity to serve on the board has really highlighted the importance of nurses like myself. Before I had that opportunity, nursing leaders, nursing students, public health nurses, really understanding what nursing regulations are. And it's also very important segue for me to realize what also drives me is to really have impact. I don't like doing things to do. I want to be able to do something and say, okay, great, this was the outcome. That's what we do in the nursing process, right? You evaluate, reevaluate, and you make an assessment again. And so the DC Board of Nursing serves, again, one, they provide licensure for individuals once you've passed your NCLEX, et cetera, making sure you've had appropriate background checks, et cetera. And so they also license people to practice. But in addition to that, we provide oversight for all of the schools of nursing here, Howard University, my alma mater, Catholic, Georgetown, Trinity, all the other four-year universities, as well as some of the other local nursing schools that also have ADN programs like UDC, University of the District of Columbia. And also, people forget about our home health aides, our CNAs, or certified nursing assistants, and also our TMEs, trained medication aides. And so all of these things and these professions and skill sets fall underneath the Board of Nursing's purview. Additionally, we also do disciplines, which is sometimes a not so fun part of the job, where you hear stories of varying things that obviously I can't publicly share, but things that nurses have done, and CNAs that have done that range from violent acts, that range from diversion of narcotics, that range from falsifying time cards that you're sending to Medicare, Medicaid, which then becomes fraud.
Right.
So there's a variation of all of these things that the board also provides oversight for. Particularly in the pandemic, we've had to pivot. I believe that there's power in the pivot. So we had to make adjustments for what clinical nurses are needing to have, what clinical hours are needed for student nurses to have in order to graduate. And so we've had to have meetings with some of the local academic areas, the deans of schools, and they had petitioned the board to reduce the number of in-person clinical sites to have more of those clinical sites probably act like when you and I were in school, everything was all in person, to now having some of them virtually and done via simulation labs, because the pandemic, they were not allowed to come into the hospital and clinical settings because of COVID. Now that's been a little more lax because of the vaccine and the booster shot. We definitely are having more clinical sites, but at the onset, everything went to a halt. And so because of that, if you imagine if you were a senior back in 2020 and the pandemic happened in March, so your whole last semester, you're in person doing those hours. So all of those things had to be pivoted to a virtual platform. So that was something else that we had to change in our rules and regulations and the curriculum for those nursing schools. That was one of the biggest challenges that we had to overcome.
Right. Yeah, I can imagine that. My heart went out to all those students just across the board. I mean, like elementary, middle school, high schoolers, they all had their own set of challenges and developmental stages that they're in, that just everything came to a screeching halt. And
absolutely.
Yeah. I mean, anywhere you land on that ladder, it's difficult. I have very small children, so keeping them home, they were like, whatever. It's just another weekend day for us. But
And one of the things I will share with you that we had to also conquer was because of the nursing shortage. And so because we do provide licensure, there was a huge influx. We're grateful that the city council had enacted, with our mayor, of course, the state of emergency, which meant if Brianna lives in California and she came to DC to work and to get that travel job, that we as the board members also had to change those regulations. So anyone who did not have a DC license specifically are able to practice in the district for a specific period of time underneath the Emergency Act, because at that point we relinquished the requirement of having a DC license. So as long as you've had an unencumbered license from another one of the 50 states or territories, you are allowed to work here in the district.
Yeah. Is that still ongoing now, or has that been dialed back? Wow.
Yep. It's still ongoing because of particularly because of Omicron, and also just the staffing shortage.
Yeah. Yeah. Talk to us a little bit. I know you're on a surgical oncology floor, and the same issues where things came to a screeching halt, all those, what they, we consider elective procedures. Someone with cancer probably doesn't feel like it's an elective choice. They need to have these procedures done on a certain timeline. Talk to us about caring for your staff who were caring for these patients at that time.
That's something that's always been very paramount to me. I have 5 pillars of my personal leadership and what I expect of my team members. The first one is compassion, to understand that person, as I shared with you earlier, could be a family member, it could be a friend. And so that's something I can't teach. Having integrity, doing the right thing because it's the right thing to do. Having a good, strong work ethic, come to work, and to make sure that you are in a good mindset, a place and space to be able to provide the best care, because as I said before, what you do or what you don't do can literally kill someone. And so we don't have that latitude in our profession to not be of that mindset. Also, teamwork. You are only as strong, as they say, as the weakest link. And so from the EVS colleague to the surgeon to the charge nurse to myself, I tell my team, I'm the least important person on the team. My job is to make sure that you have what you need to do the job at that bedside. And so understand how the importance of teamwork is. And then lastly, I ask them just to really communicate with me. I know for a fact, and I don't need validation, that I am a good nurse. I know my clinical skill set. I know my heart and passion. It is nice to be validated and to be appreciated, absolutely. But I am a mind reader. And so however I can assist you, I am begging you to tell me, what can I do? Is it a day off? Is it that you just need to come in an hour late? Or is there something going on at home where you need whatever it is? Or do you need extra training for something different? Did you forget how to don and doff your PPE to make sure that you're safe from COVID and make sure that you're able to get home safely? Do you need to figure out how can you go get that rapid COVID test downstairs, and can I maybe expedite that for you? So all of those things are something that I only know if my team member communicates. So caring for my team while they are caring for those patients, those are the 5 tenets that I honestly kind of adhere to. And I ask them every day. We have huddle. Does anybody need anything? I literally end with, does anybody need anything? And I mean that sincerely. Sometimes it's, oh, okay, I'll go get you a cup of coffee. Or sometimes it's, okay, let me go help pass that med to help you. Even though I'm a director, I still am very much so hands-on. I still, as in the healthcare world, I still get my hands dirty. I don't mind to turn a patient. If the bed alarm goes off, I run in there just like I expect my team members to go in there, so we can provide safe care. So for me, Brianna, I just think it's important of presence, of making sure that my passion is shown through my presence, and then always letting them know that I'm here for you. And also then holding them accountable to say, if something is going on, I need you to tell me, because I'm not of mine.
Yeah. For those that are watching or listening to this right now that are also in nursing leadership roles like charge nurse or nurse managers, I think we've heard this topic come up, how to not be a micromanager, but also, like you said, your presence is so important to show that you're willing to jump in there when needed, but without giving the impression to your team that they're not capable of doing it at the same time, through micromanaging, that I think a lot of people tend to fall back into. how do you combat that? As I think a lot of nursing leaders are strong, they like to have control. It's hard to give up some of that control. What advice would you have for them to be someone that works alongside your team rather than looking, nitpicking what they're doing? Does that make sense?
It does. It's the same, I am a person of faith unashamedly, so I have no problem sharing that. I'm always reminded of the scripture and the Bible parable that talks about teaching them to fish versus just feeding them with the fish. And so for me, it is so important to make sure that I surround my team with positive energy. I am the silly one that's there. And whenever someone has a question, I always say, oh, did you ask the charge nurse? Or what did Raquel say? Who's one of my charge nurses? What did this person say? I don't just, I know that as a leader, I've made that pivot as I've grown, because early on in my leadership, which is what I think people need to understand, and those that are watching, there's a huge difference of leading and managing. Yes. And so there are some times where you do need to manage scenarios. Joint Commission comes in, or Department of Health is here. Yes, that's not a time to lead. You need to get on the floor, manage, make sure everything is in place and intact. Right. To do this. During the pandemic, there's been times where I had to pivot and do a little bit of both. There's been times when I've had to manage, okay, this is what we need to do today, and this is what we're doing. And then there's been times when I've had to lead. And I think the difference between a leader and a manager is when you're casting the vision and when you are also just kind of supporting. Management is doing the day-to-day operations. And so those persons that are leaders, or even those that are in a formal sense, but the informal leaders, like the preceptors, the resource nurses or charge nurses on the unit, understand that people are watching what you're doing. At all time. And so for me, Brianna, I try my best to not be that micromanager. There's times literally I'm in my office, and then there's some days where I literally pull up one of the wows, and I literally just sit at the nursing desk. And there's a little level area that I sit on, and I just do my work at the nursing station for the whole shift. And so if when my unit clerk gets up and goes, I just hop up and answer the phone for her. I'm not taking over, but I still have a charge nurse. I still let them do their job, but I just want them to know that I'm also not leading, and you can't lead from the office behind the door either. Right. Very delicate balance, at least for the nursing profession, right? So nurses, you need to be a nurse's nurse at heart. And then there are times where you do have to cast a vision, make it plain, make sure that people understand the why. For me is a big thing. Why are we doing what we're doing? Communicating, over communicating, and overstating that so everybody is clear. The key is to get buy-in, not agreement, which is also another differentiation. So I like that. Don't have buy-in and not have agreement, because there's times when I don't agree with everything, of course, that our CNO, our senior leadership, puts before us, but I have the buy-in because I understand the why. Now, Meedie personally, I have an issue with it, but I understand it's for the better good of the organization. And so I think that's what I would instill upon people, is to make sure you empower, you engage, you expect, and then you excel. And that's why my 4 E's for my team is I educate them so you know what's happening. I empower you to do those things. And then I have a sense of expectation. And then my last thing is for us to excel, to do those things in excellence.
I love it. I hope our nursing leaders that are listening to this are taking notes, because this is good stuff right now. We've touched on a little bit of the challenges that have come out that, were frankly already there with staffing the pandemic has just accelerated. How do you prepare for challenges that you foresee coming down the road as a nursing leader?
I think it's important, one, and I mean this in all sincerity, the first thing is always have a mental health check on yourself. It's very hard to lead and to guide. And this is people right now, whether you're a nurse or not. I really think it's important, particularly because I'm a nurse, though, I know that the importance of mind, body, and spirit. We talk about health and wellness. We talk about all of these things. But if you also are not mentally in a good place to be able to face the challenges ahead of you, you have to be able to stretch. I'm a runner. And so I think about the times of when I go running, you don't just go out and run. You can, but you might cause or create injury. There's preparation that takes place. You have to take take a few moments to stretch. You have to make sure you're hydrated. You have to make sure your pregame is on point so you can do what you need to do and succeed. So all of us that are nursing, particularly nursing leaders, I want to speak to the nursing leaders that are watching. I feel, quite frankly, people might be mad at me, but we have some of the more difficult jobs, even than the bedside nurses. Why? Because when they're there, they get to leave at the end of their shift, and they don't necessarily have to answer the phone. But for me, Brianna, is I have this phone 24/7, 7 days a week, and I have anxiety almost every day. Oh my God, is my phone going to ring at 4:30 or 5 in the morning before I get up because somebody else called out or we don't have staff? And I think it's important for nurses to create places and spaces of congeniality, of where we can let our hair down, proverbially, where we can really just release the stress and tension. And sometimes you can't overcome something you're not willing to talk about. And maybe you can then find another one of your colleagues who has experienced the same thing that can give you points and tips. So if you keep those things internalized, and if you don't share those experiences, I think you're going to set yourself up for failure. So I think it's important to have a mental check. I think it's important for all of us at some point to, and I mean this sincerely, to find a mental health provider or a counselor, or tap into your EAP, the emergency employee assistance program, the EAP. And making sure that, I'm sure all facilities have that. And if not that, at minimum, create a place and space or community where you can just really decompress, because even a pressure cooker will at some point explode if the pressure is not released at a certain point. And I believe that nursing leaders are, as I said at the onset, we're at the abyss. We're sitting here, we're trying our best to, as you've asked me multiple times, how do I do this for my team? How do I keep them engaged? But then what about me as a leader? So what about you that are watching? What are you doing to make sure you're okay? So what I will share, and for myself, Brianna, is I make sure that I take time for myself. If I have to, like there was a day about 2 weeks ago that I knew that I was not in a very good place. There was a couple of things that happened on the unit, a couple of things that happened with some of my the team members, some inappropriate behaviors. So once everything kind of settled, I said, okay, I need to leave. And I left. Everything was fine. And I came home and I went for like a 5-mile run, because I said, if I did not do that, they were not going to get the best version of Meedie. And what they were going to get is someone that was not going to add value or add activity to what was currently happening in our team dynamic. And so also having that self-awareness, that self-check, and to not feel guilty about that, whether it's getting a manicure, pedicure, or a massage, or having a drink with a colleague or your family, your friends, or go painting, whatever it is, because I know there's also male leaders. So whatever it is that you do to compress and to relax, do that. So you can come back and be the best for yourself, because as you alluded to, we have to do healthcare differently. Quite frankly, it's not healthcare, it's sick care. We have to ensure that this sick care system truly needs to be dismantled, and we need to build it again from the bottom up and really understand what we're doing, why we're doing it, how can we have a positive impact, because what we're doing now as a country is just not working. And so nursing leaders are at the forefront of that. And until we decide to acknowledge that and do something about it, we're going to be in the same place. Even after when the pandemic is over, we're going to still be here with nurses being burnt out, compassion fatigue, a shortage, etc.
Right. Well, my next question for you, we like to always ask people, what was, in your view, how society viewed nurses maybe a couple of years ago? We had the year of the nurse and the whole, as we already talked about, the hero trope that's been overplayed. And now I think what you're describing is, instead of being these heroes that swoop in and fix a system that was not working to begin with, what if we transform nursing into these leaders that can lead us out of this giant gaping wound that now everybody is aware of, not just the people that have known about it, that have worked within the system all along, but anybody that picks up a newspaper right now knows, or I guess there's not newspapers anymore, but reads their headlines on their scrolling media feed. But what are your thoughts on that? You know, so how society has viewed nursing. Has that changed how you've been a leader? And anything more you want to say about, I think you just said it beautifully about how nurses we really need a lot of nurse-led action to lead us out of where we are now. I think
correct. Well, you answered my question for me. We need nurse-led action, period. We need to not have a seat at the table. I believe we need to build our own table.
Yeah, I love that.
We need to build our own table at any hospital. My best friend is a physician. She's an ER physician. So shout out to Dr. Nicole Morione. Love her so much in Chicago. I love her to death, but nurses are the ones that are doing the work at the bedside every day. So we need to then partner. We need to truly have interdisciplinary conversations, as I alluded to earlier, from all facets of healthcare. And we are the ones that need to be at the table that are actually doing the work. No disrespect. And I say this, hopefully this won't kill me professionally because I'm being recorded. But what I will say is the people with, the MBAs and healthcare administrations are great. We need you. We need that administrative push behind us, but you all need to make sure, and I'm speaking to, the CEOs, the people in the C-suites that have never been the clinician. You need to make sure you have those clinicians with you to provide you real feedback when you are making these policy decisions, when you are making these policies and procedures in your organizations that impact the people who have to therefore do the work. You have to ask them, does this work? And as nurses, quite frankly, use the nursing process, right? You make an assessment, you go and then you evaluate, then you reevaluate, and then you test what you're going to do. And then if it works, great. If not, then you change it and you do something completely different and make another diagnosis. And so when you talk about that, that's why I'm so passionate. And that's why in the last few years, I really want people to know that nurses are more than just the handmaiden of our physician colleagues. Right. We are more than just passing out medications. We're more than just, making the bed and getting you to from the bathroom and hanging IV medications. We do so much more. We are smart. We are brilliant. We are intelligent. We are the backbone of the healthcare system. So until we decide that we are going to make a voice, that we need to do so. I unashamedly will also share this with you. I am working on something now that I've just created called the Black Nurse Collaborative. As an African-American nurse as well, we too are often underrepresented. There's not, when you look at the numbers of particularly CNOs that are throughout the country, there's a very small, minute number that are African-American or minorities for that matter. When I am being on the board of nursing, when I go to the NCSBN, the National Council of State Boards of Nursing, our national meeting, out of 300 people, I can literally count on one hand of the other individuals that look like me that are chairs of the boards of nursing. And so not just from a minority perspective, but just nurses, we need to have a seat at the table. And again, this is not healthcare, this is sick care. And so we know what's happening. We know how we need to make sure our patients have what they need to get the best care possible. We have to be more collaborative. We have to gain more respect from our physician counterparts. We have to make sure that, and not just hospitals, but health systems. So whether it's acute care, ambulatory settings, clinic settings, whatever, we have to make sure that we are at that table to say, that's not how it really works. No, it's a policy, but then how do you expect us to implement that? Right. So we don't have the Meedie or Brianna at the table to say, great idea. How can we then relate that into practice? It's not going to happen. So again, don't take a seat at the table. Let's create our own table.
Yeah, I love it. Love it. Love it. Love it. Let's talk a little bit about wellness in nurses. We've been discussing about how our healthcare system is sort of a reactionary sick care system instead of a preventative health model. How can we take that same theme and put it onto nurses and promote the wellness of nurses, whether it's to what we tell nurses coming into the profession that are maybe like, am I joining a sinking ship? Or what would we tell our nurses that are currently working in order to boost their morale, help them keep going? I think it's such an important topic, and we talk a lot about that at Nurse Tech. It's just in general, the umbrella term of nurse wellness.
So excellent question. Honestly, again, Brianna, this might be something where people might be mad at me, but you have to know yourself. You have to take care of yourself. Just as I told you the other 2 weeks or so ago, when I knew that I need a moment, and I left after everything was settled. Nurses, you cannot care for others if you're not caring for yourself. Period. Like there's no great thing. Care for yourself. Work the extra shift. That's not a problem. Do those things. But when you're off, be off. Make sure you decompress. Make sure you relax. Make sure you do those things so you're in a good mental space, because our profession, again, unlike any other, requires us to give 100% every day. There's emotional traumas, the physical aspect of our job alone, doing 12-hour shifts, the emotional bearing of what we do, depending upon, are you in the ER? Are you oncology? Are you peds? Are you labor and delivery? What you deal and what you see with every day. So I think that's also very important and imperative for us to recognize. And then that's when nursing leadership needs to be a leader and not a manager. You need to be intuitive to say, hey, Brianna looks really frazzled. She normally has on her, her hair hasn't been really and I mean this sincerely. Her hair hasn't really been combed. She looks a little disheveled. Her scrubs are wrinkled, and that's never her. What is going on? And so that's the other part of leadership, of being keeping your finger on the pulse and making sure that you are aware of your team. So yes, there's day-to-day operations, but the leader also has to care about the people that are following them.
Yeah, absolutely. We touched on this very briefly when you were talking about how it's so important to be in spaces where you can let your hair down and be around people that understand you without you having to give some disclaimer about how you really love being a nurse, but sometimes it's really hard. And I just want to get that out of the way so what I'm about to say next doesn't horrify you. It's like when people say, I really love my kids, but what are your thoughts on how community can solve that for nurses and be the space that we need right now?
I think community can help us by us sharing our stories. I think it's important for us to make sure that, as you said, that we share our stories. Organizations and groups like yours that have interviewed people like myself and many others, for people to really understand what we're going through and what being a nurse really is. You mentioned it a few moments ago about taking off the cape and realizing and understanding that no, we're not superheroes. And and as much as I know the intent of that, but then that people means or thinks that we can just keep on going and going and going, and we can't. And so I think it's so imperative for us to make sure that as a profession, we also let them know how we're really feeling. I'm grateful for the president of the ANA who put out the statement that said to Congress and the government, there is a huge nursing shortage. And if you all don't help us do something about it, if you don't help some of these students, nursing professionals help pay off these crazy loans or whatever it is, there's already going to be a huge staffing shortage. And so generally speaking, I think the community can help us by just taking care of yourself, having more of an emphasis on wellness and not the sick care, having an emphasis on, there's a little hashtag that I always use when I do social media. I said, be well and live. And so it's not just about being healthy, because healthy is just an absence of a disease process. Wellness is completely different, because you can still be well if you have a diagnosis with something. Wellness is the mind, the body, the spirit, the understanding who you are, what you're doing, caring for yourself, exercising, eating right, getting enough rest. That's what makes you well, even in the face of potentially having, diabetes or something. You're going to do your best to make sure you care for that. So for me, sharing our stories, being open and honest and transparent about what being a nurse really is and the challenges that it brings, even though we are the most trusted profession, it's one of the most difficult professions, because there's a huge clinical acumen that we have to have, but then there's also huge emotional weight that we bring every single day that we step foot into, whether it's a hospital, clinic, or school nurse, or whatever it is. It's a lot, and people don't understand what we go through. So we have to share our stories.
Perfect. Well, that is a perfect place to wrap up. I love that you are now one of the voices in our community. I know that there's so much that we've covered. I can just you're going to help so many nurses that are coming up and that have been in the profession and feeling stuck. So thank you for giving your time to us this morning. We will let you know when this is broadcast out in its many varied forms, and we'll certainly tag you when little bits pop up on social media here and there. But thank you so much. It's been awesome talking to you today.
Brianna, thank you so much. And I would love to connect offline as well. But just thank you for this opportunity to share. Thank you for the work that you and your organization does. And I'm honored and humbled to be a part of it. So thank you so much.
Great. All right. Well, we hope to see you over on our social site.
Yes.
Talk
Have
soon.
a great day. Okay. Bye-bye.